Doctors of Reddit, what made you say, how are you not dead? I'm a medical scribe but work closely with the doctors. We had a cancer patient whose caregiver called in to request a refill on morphine drops, as they were almost out. The problem was that the prescription was for a 30-day supply, and they had only had it for a week. The patient is hospice, meaning they will be dead soon, so the doctor agreed to refill the medicine. We figured the caregiver had been dosing more often than the prescribed 3 times a day, so the doctor said we'd increase the amount per dose since clearly the original prescription wasn't working. A couple of hours later we get a call from the pharmacy. The caregiver is saying that the dosage has been lowered, not increased. Which makes no sense. The original prescription was 0.5 milliliters 3 times as a day as needed for pain, and this one was for 1 milliliter. Literally double the original dose. The pharmacist has a brilliant idea and asks the patient to mark on the enclosed dosage cup where they're filling it for each dose. Turns out, they've been giving the patient 5 milliliters 3 times a day. The doctor was shocked. That's much higher than the recommended dose, and it's very lucky that the patient didn't stop breathing from an overdose. The patient was Mick Jagger and he considered that sober enough to drive. Not a doctor, but as a nurse, I have had conversations with people who have a blood alcohol level of over 0.45, which is not consistent with life. For reference, a DUI is typically 0.08 or higher. They had too much blood in their alcohol stream. Friend's dad is a trauma surgeon. A man came into the trauma center via ambulance with an amputation of his left ankle and a partial amputation of his leg, among other issues, severe bleeding from his femoral artery and multiple other crush injuries. Honestly, he was so surprised that he was conscious and talking and he actually ended up surviving but had to have a few amputations and multiple surgeries. Not a doctor but my almost 90-year-old grandma just survived a colon cancer like it was a cold. She sounds as strong as a tank. Fun fact. The original M1 Abrams tank is designed after his grandma. So in fact, tanks are as strong as her. Fun fact. 0 M1 Abrams have died to colon cancer. Not a doctor but my big sister had a Wolff-Parkinson-White syndrome that remained undetected until one day her heart eventually just stopped. She got reanimated more times one should be able to survive to and eventually ended up paraplegic with memory issues. Doctors told my parents they just couldn't understand how she survived it without ending in a persistent vegetative state. That was 10 years ago now and she's perfectly fine in a wheelchair. Even her memory troubles eventually became very slight compared to what it used to be. Google's Wolff-Parkinson-White syndrome. Great. Another thing to be paranoid about. Sorry mate colon. It can be treated if detected though, so just go have a check with a cardiologist and you'll be reassured. It's good to try out random checks sometimes even if it costs money. My whole family did it after my sister's accident because doctors said it can be genetic. Not a doctor, but an emergency medical technician. Got a stroke call for a semi-elderly lady. We show up to the apartment and my partner goes to perform a stroke test and assessment on the woman. I begin to talk to the patient's daughter, who is also the caretaker. I ask if she was prescribed any medications, specifically for her heart. And she pulls out this bag with maybe a dozen or so bottles and says most are for her heart. I begin to look through and I see medications for high cholesterol, high blood pressure, CHF, arrhythmia. I mean this woman's heart was terrible. So I ask the daughter if her mom had been taking her meds recently. She laughs a little and says of course not. Not in months. I look a little wide-eyed at her and I ask, then what has she been taking? She pulls out 2 bottles from her pocket. One is St. John's wort, the other is organic thyroid medication. Turns out the daughter is a holistic medicine therapist and doesn't believe in modern medicine, or, apparently, heart disease, and she first noticed her mom's stroke symptoms 12 hours ago. When positive thinking, deep breathing and counting backwards from 100 didn't work. They called us. At this time, my partner comes back out and says we had to move. Half this woman's face looked like she was melting and she had no movement in her left arm or leg. The nurse chewed the daughter's ass out at the hospital. Never found out if that woman made it. TL. Daughter tried to get mom to think the clot out of her brain. This shit is why I think woo-woo medicine should be illegal. My friend got this a lot. She spent years making frequent trips to the hospital to be treated for sepsis because her kidneys were ducked. Just had surgery a few months ago and is finally living life as though it is going to last. Also, my brother got this after his car accident. The doctor reckons skinny jeans are the reason he didn't bleed out when his femur tore out a chunk of his femoral artery and he was stuck in the car for 2 hours before first responders got him out. Thank God for skinny jeans. Ah yes, the power of sexy tights. The emo phase saved my brother. What irony. We had a guy come in with a swollen stomach, no pain. Essentially normal vitals. CT scan showed signs of poor blood flow to the bowel. We took him back to surgery, opened him, and found everything from his stomach to the colon was dead. There was partially digested food floating around his abdomen. Closed him up and told the family he had an unsurvivable injury, but this dude lived essentially normally for another few days before finally deteriorating. Just insane. I'm still not sure how he survived so long with his entire gut dead. I've seen some crazy stuff like that with crack addicts. One of my very favorite patients died because of the necrosis of her guts from crack. She was a hooker who had been turned out on the streets when she was a teenager, never really had a chance and did what she could to survive, but was one of the kindest, most considerate people I ever met. I told her she would have made a great nurse if her circumstances had been different. She died just like you described above. Mexican doctor here. When I was in the 4th year of med school, I was doing a shift in the ER of our training hospital. As students in my school, we were required to do shifts due to lack of personnel to do basic stuff like taking blood samples, placing Foley catheters, etc. One Saturday morning, around 10 probably, a patient walked in with a knife stuck on the side of his head, temporal area. Guy just walked in, knife stuck on his head, talking normally and everything. Everyone was absolutely puzzled. Guy turned out to be a construction worker who got in a fight with a co-worker. Patient tried to hit co-worker with a shovel. Co-worker dodged it and stuck the knife in the guy's head. Co-worker freaked out and ran. The patient looked for a taxi, couldn't find one, decided to go ahead and take a 40-minute bus to the hospital. As you do. They took a CT scan, impossible to interpret obviously because of the metal, and they sent him to the OR to be taken out by a neurosurgeon. I heard later that the knife had apparently gone inside only a few millimeters on a venous sinus and the knife got stuck in the bone. Guy has checked out the next day or something. Crazy. Pretty sure you're the only person to appropriately answer the question. Thank you. Thanks for watching Reddit now. Be sure to like and subscribe.